Hello, and welcome to the Student Health Center's online Narcan training. Today, we will be overviewing the following topics. What are opioids? Fentanyl facts. What is Narcan? Recognizing an overdose. When and how to administer Narcan. And developing a safety plan. What are opioids? Opioids are natural, synthetic, or semi-synthetic chemicals that interact with opioid receptors on nerve cells in the body and brain and reduce the intensity of pain signals. The main reason opioids have a high addiction potential is because they relieve pain and create a sense of euphoria, which many people find pleasurable. There are several different types of opioids. Prescription opioids are ones that healthcare providers typically prescribe to manage moderate to severe pain. These include common types of oxycodone, hydrocodone, and morphine. Synthetic opioids, such as fentanyl, was created as a more potent pain relief in the healthcare setting, but is now being illegally made and sold through drug markets for its heroin-like effect. Illegal opioids, such as heroin, is a morphine derivative drug exclusively used for recreational purposes and is illegal. Let's take a moment to review a little bit more about fentanyl. Fentanyl can be fatal in small doses. It is 50 times stronger than heroin and 100 times stronger than morphine. It is often added to heroin, cocaine, meth, and counterfeit pressed pills posing as Xanax, ecstasy, Molly, oxycodone, or Adderall as a combination product, with or without the user's knowledge, to increase its euphoric effect. Only 2 milligrams is enough to be lethal. How you can save a life with Narcan. Narcan is a potentially life-saving medication designed to help reverse the effects of an opioid overdose in minutes. Since most opioid overdoses occur in the home and are most often witnessed, having a Narcan rescue kit nearby can make all the difference. Brain damage can occur after 4 minutes without breathing, and death can occur only 4 to 6 minutes later. How does Narcan work? Narcan is an opioid antagonist. This means it attaches to opioid receptors and reverses and blocks the effects of other opioids. Narcan can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose. It does not affect someone who does not have opioids in their system, and it is not a treatment for opioid use disorder. How to recognize an opioid overdose. First, check for responsiveness. If you suspect an overdose, shake their shoulders, shout their name, and ask if they are okay. Check for signs. Is the person unresponsive to touch or voice? Is their breathing slow, uneven, or stopped? Are they snoring or making gasping noises? Are their fingernails or lips blue or purple? Or do they have constricted or pinpoint pupils? If so, call 911 and administer Narcan as soon as possible. Let them know you suspect an overdose, that you have Narcan, and you plan to stay with them until help arrives. The following slide will show us how to properly administer Narcan.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help reverse an overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders, shout their name,
Kevin.
And ask if he or she is okay.
Hey, can you hear me?
Then check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open the Narcan nasal spray blister pack. Remove and review the printed Quick Start Guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the Quick Start Guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray in the blister and cartons provided. Store below 77 degrees Fahrenheit, 25 degrees Celsius. Excursions permitted up to 104 degrees Fahrenheit, 40 degrees Celsius. Do not freeze or expose to excessive heat above 104 degrees Fahrenheit, 40 degrees Celsius. Protect from light. Narcan nasal spray is not a substitute for emergency medical care.
Possible side effects of Narcan. There is little to no side effects associated with the actual Narcan medication. However, people who are allergic to naloxone hydrochloride should not receive Narcan. People may experience opioid withdrawal after administering Narcan if they are a frequent opioid user. Consider your safety plan. 1. Think about where you plan on keeping your Narcan. Make sure your Narcan is in an easily accessible, unlocked location. Confirm that roommates, housemates, and/or friends know where it is. 2. For Narcan on the go. Keep the device in the original hard plastic container until it needs to be used. It is designed so that medication isn't accidentally discharged or wasted. Do not store Narcan in your car. Narcan needs to be stored at room temperature, and cars typically are hotter than the reported outside temperature. It is safe and legal to fly with Narcan in your carry-on luggage in the U.S. If you have any questions about Narcan or this training, please contact our Student Health Center staff. Thank you for taking the time to watch this training.